All right, future nurses, let's talk about something you are going to see a lot on the wards, atelectasis. You sent in some seriously in-depth sources on this. So we're going to do a deep dive and pull out the need-to-know stuff that'll actually stick with you during clinicals.
And what's fascinating is that while the definition is simple, collapse alveoli, the ripple effects are huge, and that's where you as nurses come in.
You know, when I first skimmed these sources, I have to admit the medical terminology was a little intimidating. But then I started thinking about how it all connects to what nurses actually do at the bedside.
It's all about the why behind your actions. Think about a post-op patient who's in pain and not taking those deep breaths. Atelectasis can set in fast in that scenario.
That's a great point. So for our nursing students who are just starting to wrap their heads around this, let's break it down. What exactly happens when alveoli collapse, and why should they care?
It all comes down to gas exchange. When those tiny air sacs collapse, oxygen can't get into the bloodstream efficiently. And for nurses, this impacts everything. Your assessment skills, like recognizing diminished breath sounds or, in severe cases, cyanosis, that's your first clue that something's wrong. Then it's understanding why we're doing those breathing exercises with patients, why we're monitoring their oxygen saturations so closely.
It's not just about going through the motions, it's about understanding the physiology behind it all. And honestly, the sources surprised me with the sheer range of people who are at risk for atelectasis. I was expecting it to be all about smokers and folks with COPD, but
Yeah,
it's way more than that.
absolutely. The sources mention post-surgical patients, people with neurological conditions, even seemingly healthy individuals who've been on prolonged bed rest, and there's a clear reason why each group is vulnerable.
Okay, let's unpack that. Why are these seemingly different groups all at risk?
Take post-op patients. They're often in pain, which makes them hesitant to take deep breaths. Plus, they're immobile, which actually restricts lung expansion, as the source explained.
Makes sense. You're not exactly going for a jog after major surgery.
Exactly. Then you've got neurological conditions where it might not be the lungs themselves, but the brain's ability to control breathing that's compromised, and prolonged bed rest. That was a real eye-opener for me. Even if someone's otherwise healthy, if they're not moving enough, they're at risk.
So it's like inactivity leads to shallow breaths, and shallow breaths increase the chance of atelectasis. And speaking of chances, the sources didn't hold back on the symptoms. Some of them were less obvious than I expected.
We all know about shortness of breath, but did you know even a cough can be a sign of atelectasis?
Really? I always thought a cough was just the body trying to get rid of something irritating.
It is in a way, but in this case, it can be the body trying to fix the atelectasis by clearing the airways. And paying attention to the type of cough, whether it's productive or not, can give you valuable clues about what's causing the problem.
So it's not just about that the patient is coughing, but how they're coughing. That's an important detail for nursing students to remember. And then there's sputum. I'll admit I tend to gloss over that part.
It's easy to dismiss it, but sputum can actually tell you a lot about what's happening in the lungs. The sources mention that it can indicate infection or inflammation, which can make the atelectasis worse.
It's like putting together a puzzle.
Yeah.
You've got the cough, the sputum, and then you've got cyanosis, which is a pretty hard to miss sign.
Yes. Cyanosis is a late sign, meaning oxygen levels have dropped significantly. It's a signal that the situation is serious and you need to act quickly. Speaking of acting quickly, early diagnosis seems to be a major theme running through all of the sources.
Absolutely. So what are the tools that nurses have to catch atelectasis early on?
Your stethoscope is your best friend. The sources emphasized how crucial it is to listen to those breath sounds. You might hear diminished sounds or crackles in the areas where the alveoli have collapsed.
I can already picture myself in clinicals fumbling with my stethoscope and trying to differentiate all the different breath sounds. Definitely need to brush up on those skills. What about other diagnostic tests?
Well, there's the chest x-ray. One of the sources had this incredible visual that actually showed what atelectasis looks like on an x-ray. You can literally see the affected area, and it's a great way to confirm the diagnosis.
Definitely adding X-ray interpretation to my study list. But what about something we can do right there at the bedside without having to wait for imaging results?
Pulse oximetry. It's more than just a number. You're looking for trends. If you see a patient's oxygen saturation steadily declining, that's a major red flag. It could be atelectasis or it could be something else entirely, but either way, it needs further investigation.
So we've talked about assessment, we've talked about diagnosis, but what really got me excited from these sources was the emphasis on preventing atelectasis. It's like nurses have a superpower here.
And we do. This is where your actions can truly make a difference in preventing complications and improving patient outcomes.
All right, let's dive into these interventions. First up, frequent turning. Seems pretty basic, right?
It is, but it's also incredibly effective. Think about it. You're not just flipping a patient over. You're changing the distribution of pressure on their lungs, helping to prevent secretions from pooling and encouraging better airflow.
It's like giving their lungs a mini workout without them even realizing it.
Exactly. And then there's incentive spirometry. I know, no, it doesn't sound very glamorous.
But wait, didn't one of the sources have this cool visual of how it works? It showed how it encourages those nice deep breaths. I could totally use that to explain it to a patient.
Patient education is key. You're not just handing them a device, you're explaining why it's important and how it helps to open up those alveoles.
Speaking of opening things up, let's not forget early mobilization. The sooner we can get our patients up and moving,
The better. Walking, even for short distances, helps to expand the lungs and clear secretions. But the sources also acknowledge that it's not always easy, especially for post-surgical patients. Pain fatigue, fear of pulling stitches. These can all be barriers.
So what can nurses do to help overcome those barriers?
It's all about creative problem solving. Maybe it's working with the patient to develop effective pain management strategies or breaking down activities into smaller, manageable steps. The key is to find what works for each individual patient.
Okay, so we've covered a lot of ground on prevention. But what happens when, despite our best efforts, atelectasis still develops? That's where the medical team steps in with more advanced interventions, right?
Exactly. And even though nurses might not be the ones performing these interventions, it's important to understand what they are and what they involve.
So let's walk through those.
One of the sources talked about bronchoscopy. Essentially, it involves inserting a camera into the airways to visualize and potentially remove any obstructions. It can be really helpful when mucus plugs, foreign objects, or even tumors are causing the airway to collapse.
Wow, that sounds pretty intense. What about thoracentesis? That's one that always seemed a bit scary to me.
It can sound intimidating, but it's often necessary to relieve pressure on the lungs caused by fluid buildup in the pleural space. Basically, it involves draining the fluid, which allows the lungs to expand more easily.
So it's like taking the pressure off, allowing the lungs to do their job. What other interventions did the sources mention?
Well, there's PEEP and CPAP. These are mechanical ventilation strategies that can be a bit confusing to differentiate.
The source did a good job of explaining the difference, though, right? PEEP is usually for patients on ventilators, while CPAP is for those who can breathe on their own. But how do they actually work?
Both maintain positive pressure in the airways, which helps to prevent those alveoli from collapsing. Think of PEEP as a constant pressure support for those on ventilators, while CPAP is like a gentle splint keeping the airways open for those breathing on their own.
So it's like giving the lungs a little extra help to stay inflated and do their job. We've covered a lot of ground here, from the tiniest alveoli to some pretty complex medical interventions. But what's the main takeaway for our nursing students?
Here it is. Atelectasis is common, it's often preventable, and nurses are on the front lines of recognizing and managing it. Your assessment skills, your knowledge, and your attentiveness, they all make a difference in patient outcomes.
You're literally making a difference every single shift. And remember, the sources stress the importance of tailoring care to each individual patient. So here's something for you to think about. What patient factors would make you change your approach to preventing atelectasis?
That's an excellent question, and one we can delve into a little further. Let's explore some specific patient scenarios and how our nursing interventions might change based on their unique needs. So let's imagine we have two patients who are both at risk for atelectasis, but for very different reasons.
Okay, I like where this is going. Give me the scenarios.
First, we have a young athletic patient recovering from abdominal surgery. They're generally healthy, but the surgery and pain meds are definitely putting them at risk.
All right. So for this patient, early mobilization would be key, right? Get them up moving as soon as it's safe to do so.
Exactly. But we also can't forget about effective pain management. If they're in too much pain to take deep breaths and move around, they're not going to get the full benefit of early ambulation.
That makes total sense. Pain control is more than just about comfort. It's about preventing complications like atelectasis.
Precisely.
Hmm.
Now let's contrast that with a different scenario, an older adult with a history of COPD who's been on bed rest for an extended period. Early mobilization might be more challenging in this case.
Right. Their baseline lung function might already be compromised. And they could have other health issues that make it difficult to get them up and moving right away.
Exactly. So for this patient, we might prioritize airway clearance techniques like chest physiotherapy and suctioning to help mobilize secretions and prevent them from plugging those airways.
And we definitely want to encourage them to use the incentive spirometer frequently,
Yeah,
even if they can only manage a few breaths at a time.
absolutely. Every little bit helps.
Yeah.
And we'd need to be extra vigilant about monitoring their oxygen levels and looking for any signs of respiratory distress.
So it's like having a toolbox full of different interventions, and we choose the ones that best fit the individual patient's needs and circumstances.
Exactly. Nursing is all about applying your knowledge to real-world situations and adapting your care based on what you observe and assess. And speaking of assessment, let's talk about some of the specific findings that might tip you off that a patient is developing atelectasis.
All right, back to those assessment skills we were talking about earlier. What should nursing students be looking and listening for?
The sources really emphasize the importance of a thorough respiratory assessment. You want to pay close attention to their breathing pattern. Are they tachypneic, meaning they're breathing rapidly?
I remember learning that tachypnea is often a sign that the body is trying to compensate for low oxygen levels.
Exactly. The body senses that it's not getting enough oxygen, so it tries to increase the respiratory rate to bring in more air. You also want to listen carefully to those breath sounds. Diminished or absent breath sounds over the affected area can be a key indicator of atelectasis.
So if I'm listening to a patient's lungs and I hear very faint breath sounds or even no breath sounds in a particular area, that should raise a red flag for me.
Absolutely. It suggests that air isn't moving in and out of that part of the lung as it should, which could be due to collapsed alveoli. And then there are those adventitious breath sounds we talked about, like crackles.
Those are the clicking or rattling sounds you sometimes hear when a patient breathes right. What causes those?
Crackles are thought to be caused by air passing through fluid or collapsed airways. Think of it like a straw with a little bit of liquid in it. When you blow through it, you get that bubbling, crackling sound.
Okay, that's a helpful analogy. So if we hear crackles, especially in a patient who's at risk for atelectasis, it's another clue that we need to investigate further.
Exactly. And don't forget about those visual cues. Is the patient using accessory muscles to breathe, like their neck or shoulder muscles?
Right. I remember learning that using those accessory muscles is a sign that the patient is working harder to breathe, which could indicate that their lungs aren't functioning as efficiently as they should be.
And then, of course, there's cyanosis, which we've touched on already.
That's the bluish discoloration of the skin, especially around the lips and fingertips, that indicates low oxygen levels in the blood.
Precisely. Cyanosis is a late sign of respiratory distress, and it requires immediate intervention. But the good news is that we often have plenty of warning signs before it gets to that point.
That's reassuring. So it sounds like being a good respiratory detective involves more than just listening to breath sounds. We need to look at the whole picture, their breathing pattern, their color, their overall effort of breathing.
You've got it. And remember, we're not just observing these things in isolation. We're also considering the patient's medical history, their current condition, and any recent procedures they might have undergone.
It's all about connecting the dots and using our clinical judgment to determine if those findings are consistent with atelectasis or if something else might be going on.
Exactly. And that's where your critical thinking skills really come into play. You're not just checking boxes, you're analyzing the data and forming a clinical impression based on all the available information. Now let's shift gears a bit and talk more about some of the specific interventions that nurses can use to prevent and manage atelectasis. We've already touched on a few of them, but let's dive a little deeper.
Okay, let's get practical. What are some strategies that nursing students can use right now in their clinical rotations to make a difference for their patients?
Well, first and foremost, you want to champion those basic nursing interventions that we know are effective. Frequent turning, for example, is a simple but powerful tool. The research shows that turning patients every 2 hours can significantly reduce the risk of atelectasis.
But it's more than just flipping them over, right? It's about ensuring good lung expansion and preventing those secretions from pooling.
Exactly. And that might mean adjusting their positioning slightly, using pillows to support them, or even incorporating some gentle chest percussion to help loosen those secretions.
And what about incentive spirometry? That's one I've seen used a lot in the hospital. But I'm not always sure if patients understand why they're doing it.
That's a great point. Patient education is crucial when it comes to incentive spirometry. You need to explain why it's important to take those deep breaths and how it helps to prevent their lungs from collapsing.
And didn't one of the sources mention that there's actually a visual component to incentive spirometry that can be really helpful for patients?
Yes, many incentive spirometers have a gauge or a ball that rises as the patient inhales deeply. It provides them with visual feedback and can be really motivating, especially for patients who are struggling to take those big breaths.
I love that. It turns it into a bit of a game, which can be way more engaging than just telling them to breathe deeply.
Exactly. And don't underestimate the power of positive reinforcement. Praise their efforts and encourage them to keep using the device regularly.
Okay, so we've covered turning incentive spirometry. What about early mobilization? That seems like a no-brainer,
Hmm.
but it's not always easy to implement.
You're right. Early mobilization is essential for preventing atelectasis. But it can be challenging, especially for post-surgical patients who are in pain or who have mobility limitations.
So how can we as nurses help facilitate early mobilization in those cases?
It starts with a good pain assessment and effective pain management. If the patient's pain is well controlled, they're more likely to be able to tolerate moving around.
And it's not about forcing them to do a marathon right after surgery, right? It's about taking small steps, literally.
Exactly. It might be as simple as helping them sit up in bed, dangle their legs over the side, or even just walk a few steps around the room. The key is to start slowly and gradually increase their activity level as they're able.
And sometimes it's about getting creative with our interventions, right?
Absolutely.
Yeah.
For example, if a patient is hesitant to get out of bed because they're afraid of pulling their stitches, you might suggest using a pillow to splint their incision when they cough or move.
That's a great tip. It's all about anticipating potential barriers and finding solutions that work for each individual patient.
Precisely. And don't forget about the importance of collaborating with the rest of the healthcare team.
Right. We're not in this alone. We can consult with physical therapists, occupational therapists, and respiratory therapists to develop a comprehensive plan of care that addresses the patient's specific needs.
Exactly. Teamwork makes the dream work, as they say. And sometimes, despite our best efforts, a patient might develop atelectasis that requires more advanced medical interventions. Let's talk about those next. So those are some things to consider when it comes to prevention.
Right. And like you said, sometimes even with our best efforts, those alveoli just decide to be stubborn and they collapse.
Happens.
Yeah.
And that's when those advanced interventions come in.
The ones we don't do ourselves, but we definitely need to know about.
Exactly. Like bronchoscopy, one of the sources had this great explanation, remember?
Yeah, it's like a tiny camera they put down into the lungs, right? So they can actually see what's blocking the airways.
Yep. They can visualize any obstructions like mucus plugs or even a foreign object if a patient's aspirated something.
Okay, that makes sense. So they can actually see the problem and potentially fix it at the same time.
Right. Like if it's a mucus plug, they can suction it out right there during the bronchoscopy.
Wow. Talk about efficiency. But what about thoracentesis? That one always kind of freaked me out a little.
Yeah, it sounds intense, but the source explained it really clearly. It's basically a procedure where they insert a needle into the pleural space.
Hold on. Remind me. What's the pleural space again?
It's the area between the lungs and the chest wall.
Right. Okay, so they put a needle in there. Why?
To drain fluid. Sometimes fluid builds up in that space and puts pressure on the lungs, making it hard to breathe.
Ah, so thoracentesis is like relieving that pressure, letting the lungs expand more easily.
Exactly. The source said it can be really helpful for conditions like pleural effusions, where there's excess fluid around the lungs.
Gotcha. So even though we as nurses might not be doing these procedures ourselves, it's still so important to understand what's happening.
Totally. We need to be able to educate our patients, answer their questions, and advocate for them throughout the whole process.
Speaking of things I always get confused about, can we talk about PEEP and CPAP for a minute? I can never keep them straight.
Yeah, those can be tricky. But think of it this way. Both use positive pressure to help keep the airways open, like blowing air into a floppy balloon to make it stay inflated.
Okay, I like that analogy.
Yeah.
So what's the difference?
So PEEP stands for positive end expiratory pressure, and it's usually used for patients who are on a ventilator. It helps to keep those alveoli from collapsing at the end of each breath.
So it's like an extra little boost of air at just the right time.
Exactly. CPAP, on the other hand, stands for continuous positive airway pressure, and it's often used for patients who can breathe on their own but need some help keeping those airways open.
So it's more like a constant support, like a gentle splint for the airways.
Exactly. So keep ventilator CPAP breathing on their own.
Okay, I think I finally got it. Phew. We've covered a ton of information today about atelectasis. I feel like I've leveled up my respiratory knowledge for sure.
Me too. But the most important thing for our nursing student listeners is this. Atelectasis is common and often preventable. But when it does happen, nurses are absolutely crucial in recognizing it, managing it, and advocating for their patients.
It all comes back to those awesome assessment skills, those early interventions, and being that patient advocate. They really are superpowers.
And never stop learning. There's always more to discover in the world of respiratory care.
So to all our future nurses out there, keep asking those questions, keep practicing those skills, and you'll be rocking those respiratory assessments in no time.
And until next time, happy nursing.